Check out this episode of Cutting Edge Health, Preventing Cognitive Decline.
Dr. Uzi Kamal is a dentist specializing in sleep apnea, a breathing disorder that is one of the leading causes of cognitive decline. You know, we spend a third of our lives sleeping, which our cells and our organs use to repair themselves. It's small wonder that the quality of that sleep will affect our brains and our cognitive health. I hope you enjoy this episode and learn a lot. Why would someone talk to their dentist if they are having possible sleep apnea issues?
That's a great question. Jane, when I was in dental school, I remember I came across it was like a meme or something on social media that dissected the word dentist. And it took the first letter and it represented doctor. In the second two letters, EN represented engineer. And the TIST, the TIST at the end of dentist, represented artist. I remember thinking about that and I said, that's pretty smart. It's pretty intelligent. I shared that with my class. But it wasn't until I graduated dental school that I realized that was a very accurate representation of what dentistry is all about. But the most important thing is it always starts with D for doctor. Every dentist is by nature a physician of the head and neck and specializing in the oral cavity. It's really important for dentists to put the overall health ahead of the dental health. So if a patient comes into my chair, sits down, opens their mouth, and I can recognize some oral cancer and a cavity, I'm going to address the oral cancer first. So the overall health comes first. But why dentist? Well, I find that we are probably one of the perfect roles in the sleep apnea field because we see our patients quite regularly. But we also assess the airway every time the patient opens their mouth. So it's ideal for a dentist to be trained and be able to recognize some of the symptoms and signs of possible sleep apnea.
And why is it important that we even address sleep apnea issues? What happens if you are not getting enough oxygen at night, as far as your cognitive health?
Sleep apnea, number one, is a silent killer. It kills people in their sleep. It's a very important disease to appreciate because the majority of people don't know they have sleep apnea. It's kind of like blood pressure. You typically can't know, or typically you don't know what your blood pressure is. In fact, we see signs of it before a patient recognizes or a person recognizes they have high blood pressure. As an example, diabetes is another one. People don't run around knowing what their blood glucose levels unless they're doing some form of test. By the time they find out, sometimes it's too late. With sleep apnea, it's quite similar. A lot of my patients tell me, well, I didn't know I had this disease. I didn't know I opened my mouth or my breathing stopped or was disrupted during my sleep. In fact, most people don't know they snore or grind their teeth at night. It's usually a sleep partner that will identify that for them.